the elected officials are in the crowd, please come and join us up here.
Welcome to Chatham. Thank you very much. So yeah, so
good morning, everyone. Let's see if that's better. It's pretty loud. Spare everyone's ears. Yeah, you want to lower that, Bill? Is that better? Is that better? All right. Good morning, everyone. My name is Gyorfy, the mayor of Morris Township, and welcome to our municipal building. First, some quick housekeeping items to the press who are here. We'll ask one representative from each of the towns on the media advisory to come speak at the podium. Immediately following that, we'll ask elected officials to speak to the press directly to talk about the impacts that they're facing for their own communities. So now on to the reason that we're here today. I'd like to thank the members of the press and elected officials who are behind me to discuss something that is not just a local issue, but a statewide issue facing municipalities across New Jersey. I'd like to thank our township professionals and staff who are here this morning and who organize things at the municipal building. I'd also like to thank Mayor Bob Conley to help facilitate this joint press conference, along with Mayors Dougherty and Karr from Morristown, and Morris Plains, and Felice and Kobylarz from the Chathams, and also the other elected officials behind me from varying Morris County communities. Let me make something abundantly clear to everyone. The proposed premium increases for the state health benefit program are a gut punch to not only our towns, but to our employees and to our taxpayers. To put it in perspective, our towns were dealt blows during the COVID-19 pandemic with a burden of added costs, delays, and regulations. As we started to get back on our feet, inflation came, with huge increases for basic goods and services, causing towns like ours to push off projects and reduce long-term investments just to make ends meet. Now, as we finally have started seeing light at the end of the tunnel for our public finances, our public employees and municipalities are left grappling with insurance premium hikes of up to 24%. Let me put this into perspective for you. The burden on Morris Township taxpayers for the proposed premium increase is over $750,000 in 2023 alone. That's $794,000. Couple that with over $215,000 of increases for our employees. These are our policemen, our firefighters, our public workers, our parks and rec staff, our sewer staff, and our professional staff here in Town Hall. Think about it. These are healthcare premium increases that will be impacting those who we relied on during the darkest days of the COVID-19 pandemic, not long ago. Next, add the pension contribution increases for next year, along with the increases to prescription drug premiums. All in, Morris Township taxpayers are facing over $1 million in costs that we didn't have in 2022. Now, one might say, just raise taxes to cover these costs. If we were to raise property taxes next year to the 2% tax cap imposed by the state, it would net us a little over $450,000. That's less than half of our shortfall. Towns like Morris Township aren't going to have many options, and they'll be forced to consider hiring freezes, pauses on public investments, layoffs, and tax increases. How's that for a happy new year for our residents and for our taxpayers? When we give our employees raises next year in our budget, they'll be taking home less money. Think of that. Let that sink in. These proposed increases are bad for our workers, they're bad for our taxpayers, they're bad for our resiliency of our communities, and they're bad for our economy. You may remember that in this year's budget, the state added a record surplus to their coffers, nearly $7 billion worth. There has been a reasonable remedy for these. There has to be a reasonable remedy for these self-inflicted wounds. Make no mistake, the increases to the premium increases to this often overlooked expenditure in municipal budgets are going to have dramatic impacts on our towns. But don't just take my word for it. Take it from the mayors and elected officials behind me who are here with me today to represent our taxpayers and our employees. So I'll now turn it over to Mayor Bob Conley from Madison, who's always been a tremendous partner for Morris Township and a tremendous neighbor.
Thank you, Mayor Mark, and thank you for your leadership in pulling this together, and I'll just say ditto. Actually, in a way, this is a story that not only will you hear multiple times this morning, but could be told 564 times across the state. So that's why we are here. And I want to thank my colleagues behind me for coming out on this day, carving time out on a Tuesday, and standing here in the little chill. So, we've already heard the municipalities were faced with an over 20% rate increase. And our goal this morning is to help you understand what that means to the 2023 budgets, and hopefully to spur the state to take action to ease this burden. And let me be clear, we're not naive. We're well aware of what's going on in the outside world. Yesterday I had a conversation of insurance rates in private businesses going up 15 to 20%. So companies are faced with a similar challenge. And yes, there's a bigger challenge in our country related to health costs and insurance, but that's for another day. So all but one of the municipalities you're going to hear from are in the state plan. A plan that exists for two primary reasons. One is to provide a wide selection of health insurance options for government employees from the municipal level to the county to the state. The second is to control costs by putting municipalities together to provide a leveling of price increases, as regretfully the municipal finance model cannot deal with fluctuations in costs, especially extraordinary fluctuations. And then you throw on top of that the challenge of dealing with inflation. So I'll try to quickly put the Madison's challenge in perspective, similar to as Mayor Gyorfy did. So bear with me as I share some numbers and understand that I am a math major, numbers geek, who once dreamed of being a teacher, so this may be on the final exam. So, put in perspective, our 2022 operating budget is $33 million with a line item of $1.9 million for health insurance. That's 6% of our overall budget, a significant expense. A 20% increase on this line alone is an increase of 1% on our total bottom line, eating up half of our cap on one line. And that is even before we tackle salary, fuel, and other increases. The math, this will be on the final exam, does not work without reducing services or increasing taxes at a time when families are struggling. And then when you add in lines that are outside of our budget, our operating budget, such as library and our utilities, our health insurance costs go up to $2.4 million. This would be the equivalent, to put in perspective, of our fourth largest department. Police being number one, DPW number two, our paid fire department number three, and if health insurance was a department, that would be number four. So yes, we are facing a major budget challenge, and I even haven't even mentioned the employee share going up a total of $135,000, an average of $1,300 for each of our 103 employees. So yes, we're hoping you understand the budget challenge faced by not only our 6 communities that are represented here, but as I said before, the 564 municipalities across the state. We are also here to ask for help from Trenton. As stated, I know that this is not just a state health insurance plan problem, but we are asking for support similar to what was done for state employees, so we can spread the impact over multiple years and continue to maintain services with reasonable tax increases. That's what we're asking for. And now, I would like to introduce my neighbor to the south of Madison, Mayor Felice.
Thank you. Chatham Township's healthcare costs account for 10% of our operating budget. The planned increases for 2023 will be a large burden on both Chatham Township's tax-paying base as well as our municipal employees. Chatham Township has 49 affected employees and 62 retirees whose contributions will be increased by 19.7% in the coming year. I feel for our employees who are impacted the most Increases of this size are not something people typically anticipate or plan for. And when you couple this with the already out of control inflationary environment impacting them at the grocery store, gas station, etc., it has a snowball effect, which forces them to make hard decisions on what they can and can't afford monthly. Increases like this coming from our government are preventable, and better planning should have been done for the sake of everyone. Thank you.
Thank you, Mayor Felice. I'll invite Mayor Kobylarz from Chatham Borough.
Morning, everybody. Well, we've heard in general terms quite a bit about the impact that this is going to have on municipalities across the state, and specifically here in Morris County. I will describe some of that impact as well as it bears on Chatham Borough. But I'm also going to talk about our options in Chatham Borough for going forward. This state health benefits program, 20+% rate hike, is definitely going to hurt us in Chatham Borough. There's little doubt that, much like municipalities all across the state,
Just trying to help you out.
I appreciate it. Neighbors helping neighbors. This is how we do it in Morris County. So there's little doubt that, like municipalities all across the state, the increase will trigger property tax increases for our residents. The money has to come from somewhere. Small towns like Chatham Borough are already stretched pretty thin. Our only recourse, short of 11th hour assistance from Trenton, is to pass the cost on to our taxpayers. A significant loss of services is simply not an option. Because of this hike, Chatham Borough's annual health insurance cost will increase next year by approximately $145,000. This will amount to somewhere between a 12% and a 15% increase in our budget appropriations for 2023. The vast majority of Chatham Borough employees are currently on the more to most expensive options under the state health benefits program. There are 12 options in all. We've attempted, and this has been a very creative approach for the short-term solution on the part of our CFO, Karr and our borough administrator, Steve Williams, who's right here. We've attempted to get at least some of them to switch to lower-cost health plans by offering a cash incentive to change, in which 40% of the net savings to the borough would be shared with those individual employees. This would not eliminate the overall cost increase, but would at least mitigate the heavy burden to Chatham Borough. Now, 8 out of 40 enrolled employees have indeed switched. This has lowered next year's projected cost increase to Chatham Borough by roughly $25,000. While we had hoped more would switch, we understand fully the intensely personal reasons the vast majority of our employees have not. In fact, it was almost painful to make this ask to begin with. This is how desperate we have been. This offer was our immediate response to the rate hike. A more long-term solution, though, one that we are now considering, is to shop other health plan options. In fact, we are considering a joint health insurance fund, a HIF, for local governments, in which municipalities band together to provide health insurance for their respective sets of employees. We are aware that insufficient numbers, multiple municipalities across the state leaving the state health benefits program would reduce that program's premium money and potentially drive up costs even further. But the harm that this 20% rate hike increase will do to Chatham Borough next year has created the necessity for seriously considering such a move. I am hearing from other mayors across the state that we are not alone in contemplating this route. The bottom line here is that the cost impact of the state health benefits program's dramatically steep and burdensome 20+% rate hike has all the hallmarks of an unfunded mandate on local governments, one that will be borne by property taxpayers at a time when the rate of inflation has reached levels not seen in decades and affordability is a paramount concern for all. Small towns like Chatham Borough desperately need help from Trenton on this matter. There has got to be a way to offset this painful cost increase statewide. Thank you.
I'll now invite Mayor of Morristown, Mayor Tim Dougherty up.
Thanks, Mayor. Good morning. Thank you all for coming out. Thank Mayor Gyorfy and our mayor from Chatham Township for two issues that they brought out that I think resonate. One is the comment the mayor made from Morris Township about getting a raise and next year your paycheck is lower. That really sits with me, and I get that. And talking about inflation, for those who have families, and even individuals, as I came in today, I stopped to say hello in the clerk's office, and I was reminded that somebody picked up a can of soup was $6. I mean, it's really, very expensive to shop now for food, especially if you're a family of 3 or 4 or 5. I don't know how these parents do it, but there's something that I think that we need to at least have the discussion on. This was not a surprise. It was out months and months ago. A deal was cut with the state at 3% increase, but no deal was cut with municipalities. So hopefully something will happen, but I don't have a lot of hope that it will. But the question is, that we were talking this morning, is what's coming next year, the year after? Are we looking at another, double-digit increase? And for those who have civil service and contracts with employees like police and fire and DPW, we have contractual obligations to give the same health benefits no matter what is the issue. So when we think about changing healthcare providers, you still have to provide the same, or you can't go below what you already have. So it's always costly. You think each year, insurance goes up every year. 4%, 5, 6, a couple $100,000. You kind of get used to that in your budgets. But when you go up $1 million, and we're a little different in Morristown because we're self-insured, but our pension costs are the same as yours, and our insurance is going up easily $1 million. The same as everybody else, maybe a couple of points lower, but our insurance is self-insured is going to go up at least 16%. So it's affecting everybody across the board. Not just the state health plan, but any healthcare cost. And it does. The other 800-pound elephant in the room is eventually we're going to have to talk about how communities can merge together in ways to save tax dollars, whether it's through fire, whether it's through DPW, whether it's through municipalities merging. That's something that never seems to get talked about. And I think there's going to come a time where, you can only raise your taxes so much to your residents, and it starts to become such a burden that they're no longer going to live in your community, and it really causes a spiral downward, as we have experienced over many years in Morristown, as the ups and downs of a community. So I can only say thank you to the mayors here and the elected officials. Thank you, Mayor from Morris Township. The good words, Mayor Conley, Dad. Who I go back a long way with, and knows how Morristown operates. We are very grateful for the mayors putting this together and getting a word out there. This is a statewide problem, and I don't know what the solution is. I know that though these mayors that surround all of us surround together have to start talking about what else can we do to offset the costs of running government. And give the same service to our citizens, and that's the key. And like I said before, we're always open to talk to our neighbors. We've talked about lots of different issues, but I think there's time now that we have to seriously sit down at the table and figure out how we're going to move forward over the next decade, the next 20 years. This is what we're dealing with today, but what are we going to be dealing with 20 years from now? I mean, it just really resonated to me that I'm going to give my employees a raise, but they're going to take home less money. that really hits home. When you really think about it, it's really devastating process and projection of what's coming. So thank you again, mayors, for supporting this, and our chairwoman from the county, and our elected officials, and our business administrator from Morris Township, and all that came. Thank you very much.
Thank you, Mayor Dougherty. I'll invite Mayor Jason Karr from Morris Plains up.
Good morning, everybody. Thank you for showing up. I'll be brief on the last one, so everybody wants to get out of here, I'm sure, but some important facts. Morris Plains is a small town, roughly 6,000 people. I have 37 people that this will affect. The cost for that is $200,000. If that was inside caps right now, my maximum amount that I could raise is $214,000 without any other costs. So this is a big problem for smaller towns. I know it graduates up as you get bigger. We have pension costs, we have retiree costs. I just hired 7 people in the last couple of months. Public safety, public works, and clerical. We didn't know that this was coming down the road, but you still have to hire those people. We have an increase of roughly 700 units that are going in my town. That's residential units. We're going to need more police. We're going to need more DPW. You're going to need more employees in the office. So this is a problem that's not just for now, but this is also a problem that's going to linger on for years to come. So I think the legislature and everybody really has to get together, both sides of the aisle, sit down, work this out, and involve the municipalities. Involve the municipalities. We weren't involved with this, and I take that as a kind of a hit in the gut. And everything comes down from the state, and we're the ones to deal with it. But you know what they say, the municipalities deal with it the best, and we know how to do it. So thank you, everybody, for coming out. Thank you for putting this together, and this is a problem that we all have to discuss.
Thank you, mayors, and thank you for everyone for coming out. So next I'll invite all the elected officials to do Q&A with those from the media who are here to really talk about, on a local level, the issues that they're having and that they're facing. And I just want to reiterate this point. The Southeast Morris towns that are represented here and other towns throughout the county, we're sticking together, we work together to do what's best for our residents and what's best for our employees. And I just want to reiterate the fact that the people we've relied on so much over the past few years, again, during the COVID-19 pandemic, day in and day out, they were the ones showing up for work while the rest of us were at home. And to have this increase, like Mayor Karr said, and I said earlier, a gut punch to really their livelihoods and what they bring home to their family and how they support their families and their loved ones, it's unacceptable. So I'd like to thank you all for coming out and thank all the elected officials behind me for standing together to advocate not only for our employees but for our taxpayers. Thanks, everyone.